Welcome to the Biopharma Business Intelligence Unit, where symbolic integrity meets strategic clarity. At BBIU, we go beyond the headlines to decode the structural forces behind global biopharma, AI, and economic realignment. If you value precision, verification, and symbolic depth, this channel is for you. Subscribe now to access our weekly briefings, dossiers, and intelligence reports, and consider joining our institutional tier to unlock early warning systems, custom metrics, and exclusive strategic insight. You're not just listening, you're entering the future of epistemic intelligence. www.biopharmabusinessintelligenceunit.com.
BBIU Ophthalmology, revolutionary bioactive laser therapy for post-infectious corneal disease, DualStem-Cor. Date, August 2025. Author, BBIU Biopharma Business Intelligence Unit. Executive Summary. Post-infectious corneal disease, whether caused by bacteria, varicella-zoster virus, VZV, or cytomegalovirus, CMV, often leaves survivors with severe irregular astigmatism and permanent visual disability. Current management is limited to rigid or scleral lenses or corneal transplantation, both associated with significant limitations. BBIU introduces a novel translational strategy. 1. Excimer laser superficial ablation to remove scarred or infected corneal tissue. 2. Dual-source autologous stem cell enrichment, ectodermal origin from buccal mucosa-derived stem progenitor cells, and mesodermal origin from the stem progenitor fraction in peripheral blood, including hematopoietic and mesenchymal cells. 3. Imprinting onto a therapeutic contact lens serving as a living scaffold applied directly to the damaged cornea. This approach integrates precision surgery with autologous regenerative cell therapy, creating a new paradigm in corneal therapeutics. 1. The clinical problem: irregular astigmatism post-infection. Irregular astigmatism and scarring are the dominant sequelae of bacterial and viral keratitis. Visual consequences include high-order aberrations, poor contrast, glare, halos, and functional blindness not correctable with glasses. Current fallback includes rigid lenses for symptomatic relief only or keratoplasty, which is resource-intensive and requires immunosuppression. There is an unmet need for a therapy that restores surface regularity and delivers regenerative potential without requiring donor corneas. 2. Disease progression. Acute phase necrosis in bacterial infections, pseudodendritic lesions in varicella-zoster virus, VZV, and endothelial inflammation in cytomegalovirus, CMV. Repair phase involves myofibroblast activation via TGF-beta, stromal haze, neovascularization, and corneal nerve damage. Chronic phase results in permanent topographic irregularity, stable but vision-limiting astigmatism with limited natural remodeling. 3. BBIU proposed treatment. Step 1. Excimer laser ablation. Phototherapeutic keratectomy, PTK, or topography-guided PRK, with ablation depths of 20 to 40 microns, tailored to patchimetry. This removes scarred or infected epithelium and stroma, creating a receptive stromal surface. Step 2. Dual-source autologous stem cell enrichment. The ectodermal fraction involves biopsy of buccal mucosa and isolation of epithelial lineage stem and progenitor cells. The mesodermal fraction involves blood ultracentrifugation to isolate hematopoietic and mesenchymal stem-rich fractions. Both are prepared under sterile hospital GMP protocols. Step 3. Imprinting onto a therapeutic lens. Cells are seeded onto a lens surface that acts as a living scaffold and is applied to the corneal defect for 5 to 7 days, then replaced in cycles. 4. Biological rationale. The ectodermal lineage enhances epithelial repair. The mesodermal lineage supports immunomodulation, angiogenic control, and trophic support. This dual approach mirrors the embryological duality of the cornea, and the lens scaffold ensures direct engraftment rather than passive diffusion. 5. Regulatory strategy. Patient population for Phase 2A includes individuals with severe post-infectious irregular astigmatism, where vision is already poor and keratoplasty is the only option. Ethical advantage. The treatment cannot significantly worsen vision, and non-responders remain eligible for transplantation. Trial design. 10 to 20 patients in an open-label safety and feasibility study. Primary endpoints include epithelial closure within 10 days, absence of infection or neovascularization, and safety of engraftment. Secondary endpoints include topographic regularity, visual acuity, and haze density reduction. Study duration is 3 to 6 months, with extended follow-up of 12 to 24 months. Regulatory path defines the product as autologous cell therapy, or ATMP. Initial hospital-based pilot exemptions are feasible, with full ATMP dossiers required for broader EMA, FDA, or KFDA approvals. 6. Patient benefits include vision improvement, transplant avoidance, and safe autologous therapy, even in elderly patients. 7. Economic analysis. Estimated total cost per patient is $4,000 to $6,000, significantly lower than the $12,000 to $20,000 cost of keratoplasty. Health system savings arise from reduced transplant lists and lower rejection management costs. Commercially, this targets a multi-billion-dollar corneal disease market with potential expansion to trauma, burns, and post-surgical cases. 8. Strategic considerations. Intellectual property. A method and use patent may be possible for dual-source stem cell imprinting on a therapeutic lens combined with laser therapy. GMP logistics. Hospital-based GMP units are ideal for preparation. Comparative positioning. This approach is unique compared to PAC-CXL and RBPDAT, as it offers true autologous cell therapy integrated with Excimer laser precision. Narrative transformation. This redefines the Excimer laser from a refractive tool to a regenerative and immunomodulatory platform. Conclusion. BBIU's bioactive laser therapy with dual-source autologous stem cells is a disruptive, biologically coherent, and clinically implementable solution for post-infectious corneal disease. Clinical impact. It restores vision and avoids transplantation. Economic impact. It reduces costs, backlog, and global dependence on donor corneas. Strategic impact. It opens a new class of bioactive ophthalmic therapies uniting surgery and regenerative medicine. BBIU position. This concept is now placed into the public translational domain. BBIU invites hospitals, clinicians, and biotech companies to explore, validate, and advance this therapy.